video is about a new application of indocyaninine green for laparoscopic lymph node biopsy for lymphoma. In this case, the CT scan shows multiple periaortic and periiliac lymphadenopathies suspected for lymphoma. A bilateral inguinal injection of a solution of Isfgs is performed 24 hours before surgery. The laparoscopic exploration under infrared view shows mild fluorescence in the pathologic lymph nodes along the aorta, the left common iliac artery, and in both inguino-femoral regions. The dissection begins with the opening of the retroperitoneal space along the aorta to perform an incisional biopsy of the lymphomatous tissue. A second specimen is searched along the iliac artery, and a pathologic lymph node is retrieved in TOTO. Once the hemostasis is verified, two hemostatic resorbable meshes are left in place.